Becky.
Hello.
How are you?
I'm good, thank you.
So we spent 3 days together now. Are you sick of me yet?
Not at all.
Your only observation of me two things. Yesterday you said I had nice hair.
Yes. You
which,
do have nice hair.
Which made my day and made my day again today. Thank you. And the second thing you said I pee a lot. I wee. We're in England now. I wee. I usually in podcasts, I know it's been about an hour 15 when I really have to get up.
That's crazy.
So I try not to take wee breaks during episodes. But that's another rule I didn't tell you. I did say phones off.
Yeah.
But I didn't say that if you do need a toilet break, we can pause. Go. Otherwise, sometimes people are, they're holding it in and they're uncomfortable, and I don't know why they're uncomfortable, and you feel it in the room. So we'll get going. This is episode 39 of the Treatment Room Secrets podcast. Super excited. We've been speaking. I think we spoke for the first time like almost a year ago.
It was, yeah. We've been planning this for some time, haven't we?
I told you I'm a planner.
You are. That is true.
So it's been a while. I'm super happy to be here. We're in Edwinstowe.
We are.
The village of Edwinstowe in the district of Mansfield.
Yes.
Did I get that right?
You are, yes.
Very good. You have a beautiful clinic here where we're recording from. The first thing I wanted to ask you was swimming. Because you mentioned that you used to be a swimmer.
I did, yes.
So what did you swim? What
was my stroke?
The stroke, thank you.
So I used to be a county swimmer. And my stroke was mainly kind of front crawl and backstroke, although I used to enjoy breaststroke, and I used to run away from butterfly. Every time there was butterfly on the training schedule, suddenly I would need a wee break.
So it's a tough one to learn, no? Butterfly. I think it's me as a non-swimmer professionally at all. Maybe a few lessons when I was a kid. I think I can front crawl okay. I can backstroke okay. I can breaststroke okay. But I wouldn't even know what exact movements to do for the butterfly, and it looks really intense.
Yeah, you have to get the movement pattern correct so that the momentum brings the arms over and down, and then that momentum again then brings your arms up and over. So then you need, not only do you need the coordination and the momentum, but then also the strength in order to be able to do that. So it is definitely the hardest.
Did you ever get more comfortable with it?
Did I ever get more comfortable with it? No, I just accepted it. But with the IM relay, so individual medley, which is now we're testing my brain. Butterfly, backstroke, breaststroke, front crawl. Obviously, you had, if you did that particular relay, then obviously you would have to do at least one length of butterfly.
Okay.
So I got by enough. And then luckily the next 3 lengths were something that I was comfortable with.
And until what age did you swim?
Well, I started swimming when I was like literally a baby. Went into lessons when I was around 3 years old, like proper swimming lessons. And then
your kids?
Yeah, like my children. Yes, and my children, they started from kind of 3 months old. Very much similar. And then my eldest, who is 3 now, nearly turned 4, she's into like proper lessons now. And then I swam all the way up until I was around 16, 17. And then it kind of just got to that point where I'd actually started ice skating as well. So I was a figure ice skater. And I started figure ice skating when I was 7. So that became a little bit more exciting with all the jumps and the spins, and it was just a little bit more, rather than going up and down, up and down. Obviously, as a teenager, that can become quite monotonous. So it was kind of, I then, much to my mum's dismay, I kind of left swimming and then pursued the ice skating. But swimming is a big passion of mine still. I do really enjoy swimming. So if I was going to do an exercise of some sort, it would be swimming would be one of those. But it's blooming hard work now.
Yeah, I'm sure. Also, just I don't know, imagining swimming in England. It's cold.
Nah, well, it is the pool's not exactly heated, but they're not outdoors.
Yeah,
they're still indoors.
Okay. Yeah, and were you but besides swimming, besides figure skating, did you connect with any other sports?
Oh, I was very, very sporty when I was younger. So naturally, from doing a lot of swimming, I had a very high fitness level, especially endurance. So I was involved with a lot of kind of cross-country running, especially through like my school runs and stuff. I was always picked to do the cross-country runs, and I'm very competitive, so don't like losing when it comes to sports things. So I would push myself to the very bitter end with those, and often I wouldn't come out of the top 5, which would annoy some of the actual runners, I think, because I never actually trained in running. I just literally turned up and ran. But my swimming was where I got my fitness from.
And you were competitive with swimming too?
Yeah, very competitive. So I got competitive swimming. Oh yeah, very much so. Yeah.
And do you remember yourself getting injured in your teenage years or feeling pain for the first time?
Oh yeah,
or not pain for the first time, but pain pain from sports for the first time. Like I remember on myself, like when I think of myself playing football when I was 9, 10, 11, 12, 13, 14, you can kind of just go without even thinking about your fitness, without thinking about your muscles, and then you start thinking about your muscles because they start reacting.
Well, I actually got shoulder impingement, and that was just horrendous.
For swimming, I'm assuming.
Yeah, pretty much swimmer's shoulder, which is another common term for it. So shoulder impingement, and I ended up with it in both shoulders. So waking up at night, not being able to move my arm, just that excruciating pain.
As a teenager.
It was not pleasant.
So it's similar to what you felt as a teenager, similar to cases you must see of grown-ups coming in who try and be active or try and play sports. Is pickleball a thing here in England?
I've never heard of pickleball. Even I've not lived, and I'm missing out. But no.
Craig, here's your question. Have you heard of pickleball?
I have heard of pickleball, but I've only heard it being referred to in a period drama or so.
So it's not just me then. No. So no, okay.
All right. So it's the fastest growing sport in America.
Oh, I'm listening.
Yeah, I don't know. I think the average age of people that play is above like 60.
Okay.
It's basically a mini tennis.
Okay.
With a different ball, different rackets. It makes tennis accessible to pretty much anyone, especially when you play with pairs, because there's not much space to move.
Okay.
It's still a very quick, dynamic game. You have to be quick reactions.
Okay.
But you don't have to sprint. You don't have to stretch your legs that much.
Okay. Is it a harder racket rather than like
yes,
so it has like a harder
and a harder ball too.
Yes, I think I've seen it, but I didn't realize that's what it was called.
Yeah. So I'm just wondering. So what do older individuals here in this part of the world? What's a common sport? Like, what do people come in and you're like, you have to you're gonna have to start stretching if you're gonna play pickleball every day. Edward, I'm trying to think of an English name.
Dave. I love Dave. Skeleton's called Dave. Do you know? I'm not sure. Like, I'm not sure I'd want to pick one particular sport.
Archery. You mentioned archery a few times.
Yeah, my other half, my husband, was big into archery, and has shot for Great Britain. So it's been quite high up with the sport. And at some point, he tells me we will be going back, and that is a sport that you can pick up at any age, really. Mm-hmm. So that is a popular sport. Bowls for the older generation as well. We have a lot of cyclists around here. We have a lot of cycle routes and runners. A lot of people do running.
Is there a common injury that comes from cycling?
It depends on if it fell off or not.
If they're able to stay
on it.
Because maybe the first thing that comes to my mind is maybe the posture.
Yeah, postural, lower back. I think it really then it depends on the person and what they do in their individual, kind of occupation and daily lives.
How the
As
bike
to how
merges,
then exacerbates that, because this is kind of recreational, not actual cyclists as such. So whether it's coming from the actual cyclist cycling, do you know what I mean? I think it's more that sport can sometimes exacerbate areas rather than be the cause, if that makes sense.
Yeah. Why osteopathy?
Oh, good question.
Because also you referred a couple times to your osteopathy uni days.
Yes.
The last couple of days. You said it was intense from the first moment.
Oh my word, yeah. The first weekend of my osteopathy degree, we were all in a room, and I think it was around 30 of us, and we literally had to dress down to our bra and knickers, and obviously meant down to the underwear. Like, so you've never met these people before, and here you are in front of your tutor with like down to your underwear, and you're like, at that point, am I wearing matching set? Is this my comfortable set or my good set?
And so what's the purpose of that? Just to like break the ice, because you will be touching each other for 5 years now?
Pretty much, yeah. I mean, they literally went straight in. At the end of the day, when we're looking at when we're treating patients and working with patients, where we need to be able to be comfortable with them in underwear and be able to see the body. So, I need to be able to see the shoulder line and the spinal curves and the pelvis position and that kind of thing. And when you're learning, you do need to be able to see it more clearly. Obviously, as you're doing it on a more regular basis, and now say I'm qualified and I've been doing it a while, I don't necessarily need to obviously dress my patients down to that full level. But I may get my patients to take their top off, for example, so I can see the full spine and what's going off with that. So osteopathy, it's that first weekend was intense.
When you think of
5 years was intense.
Yeah. So when you think of those years, though, like now looking back, do you wish they focused more on something that they maybe brushed over or maybe didn't even include in the curriculum?
Yeah, so I mean, going back to your question a second ago, why I chose osteopathy, when I was looking, because originally I was actually looking at chiro, but I was coming from a personal training and a sports massage background.
So before you even stepped into osteopathy, you were already practicing sports massage, and you were a personal trainer.
Yes. So I was personal training, swimming teaching, and like you say, sports massage therapy. So when I was looking into how osteopaths treat and how chiropractors treat, and I was having regular chiro myself, I'm very good friends with a local chiropractor. And I was kind of looking at the curriculum, and I just felt that the osteopathy just blended more with the sports massage side as well, because they took more of a soft tissue element to it, as well as the joint manipulation side of it as well. So kind of working on everything. Osteopaths pretty much work on the whole body. I mean, you could say that about any profession. It's just how we come at it, if that makes sense. It's obviously the principles of where we're coming from is slightly different from one another, but ultimately we work on the same people and the same conditions, just a different way. And the osteopathic way just seemed to fit where I was coming from and where I felt most comfortable, I think.
And then to so that's the first question. The second question. So based on what? Okay, so you're entering this now with some experience in this world, and you're maybe expecting to be taught certain elements of things. And so going through it, you went through it, but now looking back at those 5 years, was there something now as someone, with your experience looking back that, they should have really emphasized more of?
Yes. So the exercise side of it, like I think we had one 2 days maximum on exercises. Like a lot of my colleagues that have never done any training themselves in the gym or, kind of had that way. I'm very fortunate that I started out in the gym. I was a gym instructor, then personal trainer. So I've got that library of exercises. I've got that exercise thinking and how to do certain movements. And they just, literally one day gave us a few exercises. If somebody comes in with lower back pain, here's a few exercises. And I just thought, that's not, whilst I don't expect like a full module, it would have been nice to have a little bit more. And I think it's such a big part as well when we're working with patients and we're treating them. Obviously then we want to give them exercises, but as a profession, if we don't even understand those exercises or how to perform those exercises correctly, how can we then police and monitor our patients to make sure that they're doing it correctly? The amount of times I see patients come in and I give them exercises, so I might use an online platform where we get exercises from, and I can send them over. It might be that they look at that exercise and they're doing the movement, but they're not doing the exercise.
They're following the instructions.
Yeah. If you know what I mean. So it looks like they're doing it, but they're not doing it. Yeah. So like the plank, for example, people can say, I can hold a plank for forever. And then you come across and go, well, relax here, relax there, tense there, pull that in, tilt that. And suddenly they can't hold it for longer than 30 seconds because now they're working it properly and they're engaging the correct muscles, so that goes on. So when it comes to that side of it, I was quite disappointed there wasn't more in the curriculum regarding that.
But you know how like earlier you were saying how like why would you, if your foundation is broken or not right, then why would you build on top of that, right?
Yes.
So is the osteopath's like innate role to first and foremost like kind of fix the foundation or try to see where the problems are in the foundation of the body and try and put it in place?
Yes.
So once that in place, so what is the so you get 1 to 2 days of exercises in 5 years of osteopathy school. So but what is the logic behind that? It's to encourage a cooperation with physios who we spoke about also, who are on the other side of the so based on what you were telling me about physios, they're basically only learning exercises and not enough about
manual therapy. I think it's we need to maybe, I don't know. I think that we need to have a balance of the two. Yes, you can't. Where I think sometimes our modern day physiotherapy fails is that they're giving people exercises when potentially that area isn't performing or isn't moving the way it should be in the first place. And I know what they're saying regarding, you can do exercises to try and get that area moving better. But sometimes if something is quite restricted or the joint's not moving very well or, there's tight muscles, etc., then, you wouldn't build a house on poor foundations. So why would you give somebody exercises when the body isn't where it should be? Because all you're doing is reinforcing that posture really and that movement. Ultimately, I think we need to work with the patient through manual therapy, however you feel is best as a manual therapist. Get the patient into the ideal position, whether that's freeing off the thoracics, loosening off the pelvis, getting the body to release in that way. And then once we get the body in the position we want it, then bring in the exercises and strengthen it. So yes, I get where physios are coming from in terms of the importance of exercise, and I 100% agree with them, but I think there is still the element that is needed for the manual therapy. And the same with what you're saying, like osteopaths, yes, we work with getting those foundations correct, but then we don't really do much because we don't understand how to reinforce them, when we're giving these exercises that we believe are correct, but don't really know how to check that the patient is doing them correctly. So I think there really needs to be that merge of the two. Maybe I'm biased because I've got that skill from both sides now because of my personal training background.
But you don't like, so I was going to say that you had that like balance maybe from just based on your experience.
Yeah.
But then you even took it a step further, because when we just got introduced to each other and I asked you what you teach, then you teach dry needling and you teach, and I heard those used to be acupuncture classes here and cupping and rehab and exercises, and there's a bunch of different things, taping even.
Yeah.
So when did you, like, was it a goal of yours to like just incrementally like learn more skills and like learn more manual therapy skills and see how they can be useful or applied in the body?
I think they've all got a place, you know. As a massage therapist, I would, you know, when I first qualified as a massage therapist, the only thing that was on my mind was muscles, because that's the only thing I was working with. I didn't know about fascia. Nobody ever taught me about fascia. I didn't really think about joints. You know, joints move. You know, I knew about chiropractors, but I didn't really understand the link between the two, because as a massage therapist, you only ever get taught how to massage muscles. It was only then when I went onto my osteopathy course, I started to kind of build on that and go, you know, that's why that would never release. So, for example, the amount of times I would work around the periscapular area, so, you know, through the rhomboids, mid-traps, etc., and find these stubborn knots. And it was only as an osteopath that actually I realised that some of the rib cage itself was restricted, and it was the rib cage that I was feeling, not necessarily the muscle. So I would articulate and manipulate the rib cage through that area, and then I'd go back to the soft tissue and it's released. And I'm like, all those years I've been, as you would call, like digging for gold, you know, like trying to get rid of these knots and they're not going anywhere. And I think, oh, you know, it's something I'm doing or missing, etc. And then you start to look at other things like, you know, you go on these CPD courses and you learn how to use acupuncture and dry needling. And I did it originally to try and save my own joints, because I said manual therapy is quite hard work on the therapist. But actually you put these needles in and then you come back, and the amount of tension that's just gone from that area in a way that you would never get through doing it through massage. Because if an area is tight, naturally that is going to cause discomfort. If the person is in discomfort, they tense. So you're trying to relax them and they're tensing, and it's just this fighting, you know, this losing battle. So by using acupuncture, you're then allowing the patient to just have 5 minutes, you know, relax in that session. Because if nothing else, the patient's usually running in from work or they've had the kids all day, so they've got that level of stress. And then they can, you know, just take that time to just relax and, you know, and allow the body to come down, and you go back to it, and it's just amazing how much of an improvement you get. And the same with cupping. You work on cupping, and it's working in a completely different way, you know, through massage and through osteopathy, articulation, and moving through HVT.
And even cupping is like an umbrella term, right? Because even within cupping, there's different categories of techniques and modalities, and
absolutely,
and how you're applying the cups on someone and how long you leave the cups on for, and all these different things.
Yeah. So you're working in like fascial wise. So you're working in a different soft tissue, and yeah, like you say, there's so many different ways of using it, and there's just no right or wrong way. It's just finding what you know. Ultimately, what I found from being an osteopath is, what is it you want to achieve? You know, what do you think is going off with this patient? Where do we need to get this patient, and how are we going to use these tools in our toolbox to get our patient there?
When someone comes in, do you literally ask yourself that?
Pretty much, yeah. Yeah, so I'll often say to my patients, like, because patients as well get a little bit confused between chiro, osteo, physio, sports massage.
You can't blame them too, right?
Yeah. Oh, absolutely. Yeah. And because we all blur the lines as well. By the time we might qualify as an osteopath, but work very much like a chiro, and a chiro might work very much like an osteo. It depends on what they go off and their beliefs and where they go with it, you know. But I'll often say, you know, you might see, for example, myself, who's an osteopath, and then you might see another therapist who's a sports massage therapist, and they have the same toolbox. we can both do acupuncture, dry needling, we can both do cupping, we can both do massage. Potentially we can, some massage therapists have gone on to do manipulation courses. That's just tools. It's like a joiner. You can have a joiner and a handyman. Yeah, handyman's learnt as he's gone, and he's got exactly the same tools in his box, a chisel, a hammer, a puzzle gun, whatever it is that's in his toolbox. And then you've got the joiner. They're very different in terms of what education they've been through and how they see it. So as obviously an osteopath, we've gone through 5+ years, same as chiropractor, to learn about the body and the different conditions and how we're going and what we're trying to achieve, because we understand it in a little bit deeper way than, say, for example, a massage therapist. So whilst we might have the same tools, we come at it in a different way. Not that I'm taking anything from anyone else, but ultimately these are just added tools to try and achieve the end goal, and it depends on what you're trying to achieve.
So what you're trying to achieve is like the starting place. And I asked, like, if you ask yourself that literally, because I do think it's important, especially for people, and again, this is like in any profession really, like people think it's silly to like, okay, ask yourself, what is it I'm trying to achieve? But I'm assuming a lot of people can get into a rhythm of treatment. Maybe you see all the time, and then you're creating your own templates.
Yes.
That you're always using.
Yes.
And that can be limited for the practitioner.
I've been there. I've done that. When you work on your own and you have patient back to back, you can. Some days I would have 8 to 12 patients in a day, depending on the day. Even on the lesser size, 8, it's still a lot back to back. And you can become, it's on a conveyor belt almost, rather than actually stopping, focus on that patient. What does that patient need? And especially when...
It requires immense focus, no?
Absolutely. And especially if you've seen that patient a lot, sometimes you assume what's going off with that patient, and it's not necessarily a bad thing, because when you get to know your patients, you get to know what works and what doesn't work for them. But then sometimes you forget to look outside of that scope as well. So you do have to really be quite disciplined with yourself, and right, this is the person. What is it that this person needs? What do they do, and where do I need to get them to? So whether it is, one of my sports athletes that had got 8 weeks to get back on the bike, that needs to be bam bam bam, very streamlined, we need to get on this, to somebody that we're just starting to get back up and running, and there isn't that time frame, but it's just what it needs to be individualized. And it is so easy to become unfocused, I suppose.
Do you find yourself though challenged continuously with like new cases, and you really do have to sit down and think like, okay, what is going on here? Like, Craig was saying how he, like, setting up the podcast on a remote location is like an exciting challenge technically for him. So I'm just like, when someone comes in with something that's maybe that forces you, even if you're not disciplined that day, but it does force you to sit down and think, what am I trying to achieve here? Yeah. Do you like that in a way?
Yes. Very frustrating.
Yeah.
I have patients that come and see me on a regular basis, and then sometimes they'll come in and I'll be like, oh my God, you're challenging me today, like making me really think about what is going on here, because it's not always so clear cut either, especially when we start looking at the body and everything is connected. So I'll use kinesiology, muscle energy testing from time to time. So like I've got a couple of patients that'll come in and I'll test the strength through their legs, for example, and and I can't figure out where it's coming from. Is it the lower back, mid back? Sometimes it's the jaw that's causing like this weakness. It's trying to find that. And then I've got patients that keep coming backwards and back and forth, and we're just not getting to what it is that's causing this pain. And I've got one particular gentleman that, you know, comes to mind with that. He's been suffering with this ankle pain, and we've been back and forth through the NHS as well, just to make sure that I'm not missing anything. And it, you know, it really challenges you. You can't just, it's not one size fits all. Like sometimes somebody will come in and they'll have a shoulder injury, for example, and you go, yeah, I've seen this kind of thing before. I know roughly where I need to be. Okay, I'm just going to, you know, tweak it slightly for what I find with, you know, with that individual. But ultimately it's a similar kind of process. You just slightly, you know, individualize it. And then other times people come in and you go, whoa. Like I am missing something here. I'm not sure what, but then that just excites me because I'm just going to learn something from it. You know, every day is a learning day when you're working with patients.
Sports teams. So you mentioned before that you travel with a sports team or traveled with a sports team, but I wanted to ask you, because also, you know, you mentioned like working with an athlete, and like you know, she might have to, she might want or have to be back in 8 weeks or 2 weeks.
Yes.
Like I see these. I'm a soccer football fan, but I see nowadays like meniscus tears and stuff. They're back in like 2 weeks.
Yeah.
But in any case, so it's a whole different relationship, right? We're not trying to necessarily fix the foundation. We're not trying to look long term. We're looking at, okay, what we have to do near term for this player, or this athlete. So it's a complete different relationship. And I'm assuming also from your perspective, and you said you worked with a few sports people here.
Yes.
Does it changes that your original answer to your question of like, what am I trying to achieve here? Like they're basically dictating what you're trying to achieve here in a way.
It's always that relationship. I don't know whether it's a sports person or not. You know, it's always that relationship between you and the patient, and what they need. You know, but when it's a sports professional, then they have a bigger drive and a bigger discipline usually. To get better, because they have to get better. They have to get back in the game, and they don't, you know, and they usually have a bit more free time to be able to follow the advice and do,
to prioritize it.
Yeah, and this doesn't always go. This is just, you know, sometimes I think with professional sports players, they're a little bit more used to pushing through certain barriers, so if they're getting a little bit of discomfort, they'll continue, whereas people that aren't used to that and aren't used to that kind of feeling, as soon as they get a little bit of pain, they'll back off. So it's kind of, it's just working with the individual and what, you know, what they're used to and what they need, regardless of whether they're a sports person or not really.
What sports team do you travel with though?
So I did a little bit of work with the Vrtual Brothers last year. So Tom Birchall was the guy that Sidecar racing. So they have won the TT Sidecar racing for the last, I think,
that's
7
the
years.
crazy shoulder injury you were saying.
Yeah. So he had a big injury last year from the Red Bull races and dislocated his AC. So he separated his clavicle. Nice. Grade 3. We were literally starting from him literally having the injury, not being able to move his arm at all, within 8 weeks being back on the bike and fully strong again. So
cool. So like that, you know, back to my previous question though about like, you know, dealing with a sports person. I think what I'm trying to get to is like, let's say even a physio or anyone working with a professional sports team where maybe there's an expectation. So if they know on average a player will come back from a hamstring strain within 3 weeks, that means now you, as the person we're employing to take care of this professional athlete, we're expecting him back in 3 weeks. And if he's not back in 3 weeks, they will assume that you're not doing a good job and they'll send him somewhere else.
Potentially. I mean, I've not worked directly in that scenario. I work so they're kind of like your football teams and, you know, your rugby teams where they're kind of expecting that high level. I work with more kind of individuals, so they're still wanting that quick turnaround. Like next year I'm going to be working with a British Superbike racing team, OMG, and it's just kind of supporting their riders through being, you know, race ready basically, and keeping them at the top of their game throughout the competitions. With regards to what you're talking about, I've not really had any direct experience of that because I've not been in that kind of environment where they're employing me direct to get them back in, and, you know, that kind of what you're talking about. Yeah.
How many years have you been teaching?
How many years I've been teaching? It's a very good question. What year are we in now?
2024.
Well, I've been because I was actually teaching personal training and
swimming, you said as well.
Swimming teaching, but actually teaching other gym instructors. So I was teaching gym instructing, personal training, and I was teaching exercise to music. So I was developing those instructors. So that would be 20 years. And then I've kind of
so it's almost like part of you. It's not like something new with BTST Academy.
No, yeah. As I've kind of developed through, you know, being the other jobs that I've done, that was alongside. So maybe not 20 years, maybe 15 years. You know, I'm trying to work out how old I am. Making myself older than I am. And then as I developed my osteopathy side and my business here, I really enjoyed the teaching. So I was like, well, why don't I utilize my teaching qualifications and my assessor qualifications and start my own therapy academy, which is what we did, and it's kind of built from there. But it was just, I wanted to, like I've said, you know, I don't want to just churn out you know, therapists just because you've paid your money, therefore you get a qualification. I want to make sure that, you know, whoever comes through our learning, our courses, you know, they know they are good. You know, we haven't got 100% pass rate. I'm not going to sit here and say we've got 100% pass rate first time round, because I'm not going to just go, yes, pass. You know, I'm going to be like, no, you can do better. I know you can do better. We will work with you to do better. And then, so when you do pass, you know you are good and you will do a good job. So yes, we've got 100% pass rate in terms of everyone that's come through the doors, but not first time round.
And know. People, when I was here on Sunday, people drove hours, right?
Oh yeah,
to be here for the course.
Yeah, so we've had people come all the way down from like Scotland, which is about 4 or 5 hour drive. We had someone on Saturday and Sunday come up from Cornwall, which again is about a 5 hour drive. So people are traveling.
And what type of professions come? Is it osteopaths? Is it massage therapists?
All of them. So osteos, we've had chiros,
all manual therapists,
sports therapists.
Do you, as you know, as instructing these courses, do you feel like this niche in the UK, that people are more and more interested in expanding their knowledge, their toolkit in manual therapy, these different modalities, something like dry needling that maybe still today seems crazy to some people, but 20 years ago, 30 years ago, even more.
I find that it's a mix. It is definitely a mix. Like when I look at the amount of people that do our sports massage degree diploma, so the level 3, for example, I find that when you look at the percentage of who do the level 3 and then move on to the level 4, it's really the uptake of level 4 is a lot less than I would like it to be, because I think people do the level 3 and then they're comfortable, they're earning money.
It's enough.
Yeah. And then they'll do the CPD courses, and I think it was apparent this weekend when we're doing the dry needling course, for example, and I'm talking about anatomy, because if you don't use it, you lose it. And that's another reason why I love teaching so much, because it makes me have to know it.
Yep.
If I'm going to teach it, I need to know it. And it's very much apparent when I do these courses how much people don't remember. So I'll go, right, okay, quadriceps, the 4 muscles, can anybody tell me what they are? And you'll get the odd person and be able to name them. I'll go, okay, where do they originate? And then at that point, the room goes silent, and it's these are one of the main muscles. So if we start talking about, I don't know, the rotator cuff or the serratus anterior, for example, or the scalene muscles, people just they forget it. They use it for their exam and then they forget it. So CPD courses, when I do my CPD courses, not only am I teaching the cupping therapy, or I'm teaching the dry needling, for example, I am recapping on anatomy all the time, and I'm asking these questions and just kind of bringing it to them that you need to know this when you are working with your patient. The more you know, the better the response from treatment, which is why the level 4 and the level 5, and even going on to doing degree, whether it's physio, chiro, sports therapy, osteo, whatever it is you do, I find it, it's, if you can and you want to, then you just never can learn enough. Never. Knowledge of the body is just it. That's why we have consultants that focus on one area. 2 maximum. You'll have a shoulder and elbow surgeon. You won't have a surgeon for the whole body. It's too complex. They would never be able to learn it all and be that good at all the areas. We have specialists in each area, because it is so vast. So yeah, some people will do level 3 and they'll go straight to level 4 and they'll do all the CPDs, and then they're looking for the next thing. A bit like myself, I did level 3 and then I was like, right, okay, I want to do the next thing. Went straight on to my osteopathy, did my osteopathy. Then I went on to do pediatrics. I've done all my CPD courses. I'm constantly looking for the next course. Whereas some people, I think, just get a little bit, they're happy doing what they're doing, which is fine. But I think coming from the sports massage side, often people don't know what they don't know, if that makes sense. I didn't know to even look at the rib cage, for example, when massaging around the scapula. I instantly just assumed it was muscle, because that's the only thing I've ever been taught. So I didn't know what I didn't know, if that makes sense. And I think the more you learn, the more you realise you don't know. So it's a slippery slope.
Yeah. And it sounds counterproductive and counterintuitive.
Yeah.
But it's not, is the
Absolutely
thing.
No,
it's
yeah.
not.
Because you look back and realise actually how much you do know.
And you don't know when that next thing you learn will help you the next time someone walks through the door. So pediatric osteopathy, has that opened up this whole new world for you?
Oh,
is
absolutely.
Working on children, babies. So is it babies specifically?
Well, no, not babies specifically, but I do get a lot of babies.
So what type of thing do babies come in for?
Majority of the time it's reflux, colic, that type of thing. But we have, there's lots of reasons why a parent might bring their baby to see us. So if they've been born through ventouse, they may have a misshapen head, for example. They may have torticollis, where they can't move their head one way. They may be struggling with breastfeeding and tongue tie, so they may have had the tongue tie separated, but then they need the tongue to start doing those particular movements. So yeah, there's lots of reasons why, but majority of the time parents will bring a baby to me because they're suffering with some kind of reflux or colic.
And has that changed just, I don't know, the way you approach therapy or how you look at people?
It's one thing that one of my tutors used to say is that people often say, it's always my right side. So I'll get pain in my right shoulder, or the next time it's my right hip or my right knee. Never seem to have any problems with my left. It's always my right.
I'm the same, by the way.
And she says, you could argue that it dates back to being in the womb. So if you're sat in a certain position and then come out, and then obviously as a baby, very scrunched up, and you start to develop, yes, and start to move, etc. But sometimes if you don't have certain areas released, it could then continue through further life. And then only now that I'm actually working on babies do I start, I can start to feel these tensions and these torsions through the body, and start to realize that, yes, there might be something in that. And I can see where she's coming from, that if something's not quite worked on properly, that, it could continue throughout.
Motion is lotion. Did you and so motion is lotion, and what's the second part?
Rest is rust.
Motion is lotion, rest is rust. Did you make that up, or was it from a
I would love to say yes, I did.
A movie or a book?
No, do you know, I'm not actually sure who came up with that. But it is one of those renowned sayings.
Yeah, but is it something that
is so true?
Yes, I agree. But is it something that people don't know, or do we know it and just ignore it? Because for example, as you get older,
yes,
people, and we associate, like, you get older, your joints are less capable to do things and carry you in the range of motion, and they start locking up and hurting.
Yeah,
which is completely makes sense.
Yep.
But at the same time, also, as we grow older, we're also sitting on the couch for longer hours.
Yeah.
We also pay attention to way less. We're not as active as we used to be. Not necessarily because we are limited or can't, but no one's, inviting you to swimming lessons or to play football in the park, or, you enter a new phase of life that's very, and we're kind of dictated in a way in society how to live that part of your life. So a lot of sitting and a lot of laying and a lot of not lotioning your joints.
Yes.
Yeah. So is that something you even encourage with older folks that come through here?
Absolutely. Like my patients, they all repeat back to me on a regular basis. Yes, motion is lotion, and I'll say it. Absolutely. Yeah. It has become my motto here. I'm not sure who first originally said it, but I have definitely adopted it within my practice, and my patients get very bored of me saying it on a regular basis. But it is very, very true, and I think it just highlights, and my patients will often come in and go, oh, this was hurting, but I remembered what you said, motion is lotion, and I stick with it. So they tell me, I don't even have to say it anymore. They come in and tell me on a regular basis, motion is lotion. And I actually did a talk at a business meeting once. It was quite funny, about osteopathy and treatment and when you should have treatment, etc. And I said it then, motion is lotion, and I must have said it about 3 or 4 times. And then at the end, I was like, motion, and then the other one goes lotion. And now whenever I go to that meeting, they all go, oh, motion is lotion. I'm like, oh, today I don't even think my name's Becky anymore. It's just motion is lotion.
It's what do you think happens to you when you are facing some injury?
Yeah.
Like, not necessarily like something maybe obvious, like a car accident, you got hurt.
Yeah.
But, you tweaked your hip, or you have a sciatic symptoms, or
sciatica,
different things that are affecting you, because they're shifting you. Like when I have an injury, like I told you about my golfer's elbow, that I won't mention again on the podcast because I have a million times. But today it doesn't. But when it was more, painful in the beginning, it completely, killed my focus, because every time when I was focused on whatever I thought I needed to be focused on, I made a certain movement that would, instigate pain, and it would kill my focus, because now my entire body, even if it's for 5 seconds, is thinking about this little thing. Which I think is probably good and normal, because it's our body's way and our brain's way of maybe focusing attention on something that needs to be attended to. But you said something like when you get injured or you get hurt, like a part of you dies. Did you use those words?
Maybe
or?
not those words.
But like, also, what do you think? Like, what do you think happens to you? Because it's definitely like, it's almost like it's there to stay, and it's there to leave its mark, and it almost wants a reaction. That's how I feel. It wants a reaction. Whatever this injury is, it is provoking a reaction from me. It wants me to do something. It wants me to neglect something. It wants me to pay attention to something. It wants me to act.
They become... It becomes a fear, an innate fear, kind of a worry within themselves that they're going to make something worse. You know, when you get that pain, it's awful. So I think one of the worst pains is lower back pain, but it's not obviously the only pain. Shoulder pain, for example, is one of the other, you know, just pain in general. You get that pain, you want to do anything you can to avoid getting that pain. So if you're getting a lower back pain, as soon as you know you're going to stand up, for example, and you get that pain, or you don't even think about it and you turn and you get that pain, your instant reaction is to freeze, you know, to hold your breath and freeze. And yeah, it's just, it's debilitating. It's horrible. And it really, it gets people, it can make people really sad, really depressed. You know, it takes over your life. And, you know, that kind of natural reaction of where you hold your breath because you don't want to move. I had a patient literally coming in with this lower back pain, and every time he moved, he said he just froze. He didn't move. And I was like, that's the worst thing you can do. Like, breathe. You need to breathe and move. Motion is lotion. Don't stand there tensing every muscle in your body because you're just prolonging that pain. Pain is there to tell us that something is wrong, but it's not necessarily something to be scared of. And that's what I try and get across to my patients, you know, especially with this particular patient. When he was getting up and he was freezing with the pain, I say, right, okay, take a deep breath in, breathe out, and move through it. You know, and once he started to trust that process, and once he started to realize that actually what he was doing was exacerbating the problem. And he would know, for example, if he stood up, then potentially he would get this pain. So he'd take a deep breath in before, breathe out, and then stand up. You know, as he's breathing out, it limited the amount that he could tense. And he went from like 10-20% improvement from treatment all the way up to 80 quite quickly, because he just was moving and he wasn't holding that tension, and he started to believe in the process. But it can be very debilitating when you're getting pain, and it's scary. That's the thing. You lose yourself that way because it's scary, and you know, people can get very, very depressed with it, especially when they're not sleeping because of it as well. So you're tired, you know, you're fed up, you never think it's ever going to end, you know, and it's horrible. And to be able to work with these patients is a privilege, really, to be able to help them.
What's one thing, this is the last question, what's one thing that you can, think about that you change your mind on completely, where you think maybe like 15 years ago, you were convinced of one thing, or even 2 years ago or 1 year ago, you were convinced of a certain thing that now I'm not. You changed your mind completely over. It's a challenging question, but like you mentioned that you know, the rib cage, for example, like you didn't know what you didn't know. So is there something that you discovered that you didn't know that now you know, that you're like, you can't believe you didn't know? Or if there's
I mean, just going on that, like the rib cage, the amount of times I would work around the rib cage. And I had a particular patient come to me not long ago, and he used to go and see a sports massage therapist, and he'd be like, oh yeah, I've got a few knots around my shoulder blade area. And I was like, yeah, they're not particularly knots, that's a restricted rib. And I released the rib and then went back to her, and it was like, oh my God, the amount of times that, you know, she was getting in there with her elbows, and, you know, it'd be really sore afterwards. Yes, it would feel a little bit better, but it'd never go. It was just, I used to be that massage therapist, you know, so when we have our courses and we're teaching the next generation of massage therapists, I'm telling them, don't dig for gold. You know, if it's not, it's a bit like, you know, you got that ingrowing hair, you know, and you're trying to, you start picking at it and you're almost there. You've almost got it. And you know you're damaging the skin and you're making it red, but you almost got it. But you've got to keep going. And you never get it, but you just make an absolute mess of the area. I think we've all been there at some point. It's exactly the same as a knot. You keep digging at something and aggravating it. All you're doing is aggravating the soft tissue. You know, if it doesn't go within a reasonable time frame, leave it alone. You know, there's something else that's holding it in that position. And I think that's the light bulb, really. So when I'm working on something, even if it's, you know, not the rib or something else, if it doesn't release, I'm missing something. Something is holding it in that position.
Becky Tyler, thank you very much.
You're welcome.
Can you please just tell our listeners just briefly where they can find you, your website, the BTST Academy?
Yep.
And we'll obviously have at minimum 2 courses to release in the very near future, which we'll update about. But for now, please tell people where they can find the BTST details, and then we'll wrap up the episode.
Yep, so the BTST Academy can be found on Facebook and Instagram just by typing in BTST Academy. And then
we're in Mansfield.
We are in Mansfield. In Edwinstowe, and then you can find us. You can find our website on the good old web, www.btstacademy.co.uk, and you can find all our information there.
Fantastic. Well, thank you very much. It was a pleasure spending time with you.
Thank you for having me.
And I can't wait to be back here in your clinic in Edwinstowe soon.
Fabulous. Thank you very much.
I can vouch for how good she is as well.
Yay!
I got to say, just to kind of add on, Becky, what did you give to me? What did you do? What's the? So I don't get it wrrong.
I'm just conscious of time. I don't know if you.
That's fine.
So we just assessed you very quickly in terms of where you were restricted. So I was having a feel through your pelvis and your mid back, and then all the way up into your neck, because of what you were saying you were struggling with. We did a little bit of kinesiology, muscle energy techniques, so we could find that your legs, for example, were losing power through flexion and abduction. So we just did an adjustment to your SIJ, so sacroiliac joint, and we did a manipulation through your DLJ and your cervical spine, and just basically released a lot of pressure, and the power came straight back, didn't it?
It's incredible. I got to say that today, especially, I haven't moved this fluidly for a long time, and I haven't realised. It's almost amazing how I didn't realise there was an issue. I was like living with that kind of restriction.
Yeah.
But now it's kind of, now that restriction's been taken away, it makes me want to kind of go out and, you know, walk more. And sometimes when you think, I could do a bit of exercise today, but I'm feeling that slight restriction that you can't really put into words. But until it's been taken away, until you have somebody like yourself work on you and show you what it is like not to have that, you don't realise that you even have some kind of an issue. But it's literally, today has been the most kind of fluid movement I've had in a long time.
There you go.
Thank you
so much.
There you
go. And I saw that live, so Craig isn't lying. And I had some couple manipulations myself.
Yes.
Which I was telling Craig after, I don't trust anyone to give me manipulations, so I do trust you.
Oh, fabulous.
To put my neck in your hands.
Yay! Which is why I know you have got such lovely hair.
And on that note,
yes,
we'll end the episode. Thank you very much.
Thank you very much.